Welcome back to Stop Feeling Like Shit. And today we're diving into neuropsychiatric conditions with our guest, Cass Nelson-Dooley from Diagnostic Solutions. She's back again. We're talking about depression, anxiety, ADHD, and how these conditions are often treated with antidepressants or anti anxiety medications. But in integrative and functional medicine, we take a different approach, one that looks deeper at the root cause. So, this episode is going to be very exciting. It's going to be packed with insights into how every person is a snowflake, why testing matters, and how personalized, comprehensive treatment can help people find lasting relief without always turning to heavy medications. All right, let's jump in.
Thank you. Great to be here today.
Yes, thank
Yeah,
you.
we're
We're so
excited.
happy to see you again. Well, let's just jump right in, shall we?
Sure.
Yeah. I mean, you know what? I'm excited about this episode just because I feel like a lot of us struggle with depression and anxiety and ADHD. And I feel like most people want a quick fix to those things because it does
Mhm.
suck when you are having those symptoms. It does suck when you're going through those things. So the first thing that we do, and I have personal experience. What's the first thing we do? We call our doctor, or we're like on Google looking for a doctor that handles these types of things. And we set up an appointment and we're like, oh my God, I can't wait to go to this appointment. I'm so excited. And then you show up to this appointment and it's like 5 minutes for real, like 5 minutes. I'm not kidding
Mhm.
you.
Mhm.
And I mean, I think like what he told me was it's like spill your guts in 5 minutes. And I was like crying and spilling my guts at the same time. And then he's like, "Yeah, you're definitely depressed and you definitely have mood issues." And I was like, "Huh? How can you tell I have mood issues from this 5-minute thing?" But
Mm.
it made me question myself. I was like, "Yeah, maybe I have mood issues too. I don't know. I mean, you're the doctor." So,
Mhm.
he's like, "Yeah, we're gonna prescribe you some of these medications. You're gonna take these and you're gonna feel so much better." And off the door I went and got my prescriptions filled. And I took one of them. I didn't take the mood stabilizer just because I'm really big into fitness and, that thing just ding donged. So, I don't know if that's a problem, but anyways. So, I really into fitness and into health and stuff, so I was reading what could happen if you take these medications, which is very important, and I was like, "Definitely not gonna take that, but I'll try to take this."
This is pre-functional medicine. You didn't know anything
Yeah.
about functional medicine, so
No, I didn't know anything about functional medicine. I didn't know anything about this world actually because I grew up in a family where we did traditional medicine. We didn't know anything about this stuff and I had no idea. So I was just relying on doctors, which I never really went to the doctor anyways. But so anyways, I started taking the one medication for depression and
you remember what it was?
no, I don't actually. It was something I don't remember at all, to be honest.
But
And I don't know if Wellbutrin is something.
yeah,
I feel
Yeah,
like that's
Wellbutrin is one.
yeah,
Mhm.
okay. I feel like that was the name of it. And I started taking that medication, and I think actually I was crying more than I was before I was taking it. I was like literally hate myself. I would take it and I would be like, God, I hope it works soon. And then I'd be in my office working and I would like, oh my God, I'm gonna start bawling my eyes out. And so I'd run to my car in the garage because we worked in a house and I was like sitting in the car crying. And I was like, oh my God, I hate myself. And I was like having thoughts like, I really hate myself here. And I'm like, what is happening? But
this is when you're on the
Mhm.
medication.
yeah, I'm on the medication now, and I'm, like, crying even more, and I'm, like, hating myself, and I'm, like, really hating myself, and I'm a person that's very self-aware, so I'm like, "Why do I hate myself more now that I'm taking this pill that's supposed to be helping me feel better?"
Mhm.
And then I got, deeper into it, taking it for a longer term, a longer period, and then all of a sudden, I'm, like, having more outbursts of crying. And it was a lot of crying, not really anger. I was just crying all the time, and I hated myself. I thought I was terrible. I was, like, a terrible person. I didn't like myself, and I was, like, having these suicidal thoughts of harming myself, and I'm like, "This is wild." And so, I called the doctor, and I'm like, "Listen, something is wrong here because I'm having terrible thoughts of myself, and I'm not I love myself, I know that. So, something is wrong." And he's like, "No, you have to let the medication do its job." And I'm like, "I don't think it's doing its job, dude. I'm, like, feeling worse off." Like, I'm telling you right now, I'm in my car every day crying and I hate myself. Like, I don't like what I see in the mirror. And he's
Yeah.
like, "No, you're just not giving it enough time. Sometimes it takes months." And I'm like, "No, this is kicking in and I'm telling you it's doing the opposite thing to me where
Mhm.
something's going to happen." And I was just like, "You know what? Screw it." And I tried to stop taking that medication cold turkey, but then I got like ill from it, like sick. And then
Wow.
I was like, "Holy crap." So then I had to cut the pill in half, and then I had to cut it in 4s and just take corner pieces at a time till I finally stopped taking it, and at that moment, I realized, like, "Oh my god." Like, I totally understand now why people harm themselves because the medication made me wanna hurt myself. Like, I thought I was really gonna off myself, and,
Wow.
it was not good. So, yeah. So that was definitely scary time in my life. So I'm very excited to talk about these conditions, disorders, and about how functional medicine can help these people. And also, you give us an insight on a case study that you did. So I'm excited. So you can take
Yeah.
the floor now.
Sure. I just love your kind of from the heart stories, personal stories. I've noticed that you put those in these podcasts and these interviews, and I really love them. And you do such a good job explaining your experience. I think that really speaks to people. You know, I haven't been through anything like that, but when you hear it, you're just like blown away. And then how can the doctor, guide you that way, and not listen to what you're saying and not understand? But I think that is more like the usual experience people have. So yeah, I mean, I think one of the things that interests me a lot in this space, and I hope at some point we get to hear about the part of your story of like, what was at the root cause of that? What do you did you come eventually to realize what may have been at the root cause of your sadness and crying and difficulty coping with life? Because there probably was something that was
Yeah,
going on.
I think, my friend actually I was, like, working out and stuff, and, I love fitness, and that's, like, my outlet because I did work a lot, I worked 7 days a
Mhm.
week, 17, 18-hour days, like,
Okay.
really a lot of stress,
Mhm.
and, I was working out telling I'd just be, like, a mess, and he said, "I think your hormones are jacked up," and I was like, "My hormones?" He's like, "Yeah," and I'm like, "I don't even know what you're talking about." And at that moment, I started to learn, like, maybe my hormones are messed up. I'm like, "What is that?" You know? I didn't even know what that was. I'm from a small
Right.
town. We didn't talk about those things. We didn't
Yeah.
you know what I mean? You
Right.
you you went to the doctor and you took a pill. That's what you did. You didn't
Mhm.
talk about all these other things that could have been.
Mhm.
But that's what I did, and I started investigating what are hormones and how can my hormones be messed up? And then I went to a clinic and they did some blood work and they were like, "Oh yeah, your hormones are all jacked up." And I was like, "What?" And then I started hormone replacement therapy, bioidentical hormones.
Mhm.
And that really helped me. And it really helped me. I was like, "Wow, I feel like a different person." I'm
Yeah.
like,
This is
"Okay.
working. Yeah,
Yeah.
this is working. The other thing
Yeah.
didn't work.
Right." So that's kinda like
That's great. That's great.
yeah.
Yeah, and of course, I mean, people can have so many different root causes of symptoms of depression or anxiety. And so that's kind of our job in integrative and functional medicine, right? Is figuring out what is that root cause for each individual person. There's no one size fits all. And that's kind of, back to that point of each of us being a snowflake. We have to get a customized, we have to figure out what a unique person's issues are, their root causes, and then address those. Testing can help with that, but building the right supplement protocol and or the lifestyle changes. I mean, sounds like stress was a big piece for you too. And of
Mm.
course, I think that's huge for many people
And
in
we
our
did
country. But yeah,
adrenal
so
testing on her was bad.
Yeah.
Her adrenals were shot, and then that, of course, led to a lot of gut dysbiosis, H. pylori infection,
oh, the gut was
multiple other
involved.
infections. Yeah, gut was involved for sure too. So I think the hormones masked it for sure, right?
Mm-hmm.
The adrenal insufficiency. But then we dug deeper for the root cause and found adrenal and gut issues were huge. Brain chemistry was messed up on organic acid. So,
Okay.
kind of, getting to the root cause, we fixed all that stuff. And I think you're not crazy
No.
sometimes.
I go through moments. I think we all have our moments, right?
Yeah, right. Well, there's
Mhm.
right, exactly. There's normal ups and downs and
Yeah.
our personalities and stuff, but when you're crying every day, it's a different ball game. But that's
Yeah.
a good point too, because you guys were kind of peeling the onion, right? Peeling the layers of the onion. There was a lot there. It wasn't just one thing. And so that is that's what we do in integrative and functional medicine. So I do want to mention regarding antidepressants. Now, I don't have kind of the top statistics, like the most recent statistics, because it's kind of hard to get those. But let's say here that but based on some statistics I have, this was from some research done from 2011 to 2014. Antidepressants are one of the three most commonly used drug classes in the United States, so top three. From 1999 to 2014, the use of antidepressants increased nearly 65%. That was in 15 years. Around the time from 2011 to 2014, almost 13% of all people over age 12 were taking antidepressants. Females are twice as likely as males to be on antidepressants. And then, what I think this is one of the stats I always point out to people, 1/4 of people taking antidepressants have been on them for 10 years or more. And I always point that out because, I have a pharmacy background, and there are no studies done for these medications when they're being used for long term like that, 10 years, 15 years, 20 years.
Right.
So that's kind of the landscape. That is how conventional medicine runs the show with mood disorders. So maybe we can talk about potential root causes and how we look at this from an integrative and functional medicine standpoint. Do you guys want to do
Yeah.
that?
Yeah, that'd be interesting because I think, our background, we kind of backed into functional medicine. We started doing bioidentical hormones first.
Mm-hmm.
And I think a lot of adrenal and gut issues can be masked by getting on hormones, right?
Mm-hmm.
But then we found long term is you still had some of these people you put on hormones, and in the short term they'd feel better, but then the symptoms would kind of rear back up. And then when you
Mm-hmm.
go back and, like you said, peel the onion and really go back to the root and look at someone's adrenal function and gut function and organic acids, mitochondrial function, that's where you really get to fixing things, if that makes sense.
Yeah.
So, and it's definitely interesting. Anyone who's taken hormones that doesn't get a good result, I almost think at this point here, if someone has low testosterone or their hormones are messed up, and we see it more and more, like young people come in with hormonal issues and mental issues, and the same thing. Whenever you go back and basically the three core tests we do is an adrenal test, a gut test, an organic acid test. I
That's a good
can't tell you
point.
one time we haven't found major issues with those people.
Mm-hmm.
So, and then you can really address the root cause and get the body to fix itself instead of taking medications the rest of your life.
Yeah,
Mhm.
I think it's really wise you guys are doing that and are aware of that, because I think when practitioners start out with bioidentical hormones and that's kind of their one thing that they're doing from integrative and functional medicine, they can be missing things that are under the surface. And of course, hormones are powerful.
Now,
Hormones are powerful, and we want
I
to.
think a better approach is, fix those first. Then if they still need hormones, because there will come a point when most people might, need hormones as they age if they want
Hmm.
it to purely optimized, but get your body functioning at 100% first. And then if you need hormones, then we'll talk about it. That's a better
Mhm.
approach than just jumping into hormones.
Right, absolutely. I think that's a great point. So you brought up gut health, and the brain, of course, adrenal function. So that's cortisol and stress, which is, I think, affects all of us. Some of the other things, and then we could brainstorm some things. Of course, sleep is critical, right? If people aren't getting enough sleep, that is going to affect their mood,
Yep.
definitively. Yep. And of course, the diet is huge, getting sugar out of the diet, getting refined carbohydrates out of the diet, getting on a low inflammatory diet, anti-inflammatory diet. Sometimes allergenic foods are a real problem. If people are like falling asleep at the table, or if kids who have these big explosive outbursts right after meals, you can even see like a link between gluten or dairy or soy or egg, like right with those mental health symptoms.
Mhm.
um
You know what? We have a friend who's 40 years old, and we know when he's been eating a lot of bad sugar and gluten because he acts out. And I don't mean that and say that to be rude or anything about him. It's just he's a different person when he's not eating bad foods versus when he's fasting. And, we always say, like, we're very close to him, I mean, very close to him, and it's like, "Have you been eating bad food today because you're paranoid?" You're like, you can't even talk, you're
You can
like,
tell within 2 minutes of the conversation,
Yeah,
like, you're talking to him on the phone, and like, "Dude, what'd you eat today?"
yeah. It's
He's like
bad.
he's like, "What do you why you ask?" I said, "'Cause I can tell you ate something bad,
Yeah.
but you're just acting different." Like, it's almost like a different human being.
Yeah, it's like you gave a child for breakfast this morning Pop-Tarts and a huge bowl of cereal, and you wanna know why they're acting out at school?
Right. Why do they seem hyperactive? Yeah.
Yeah, it's kinda like that with our friend. It's like,
Right.
you're going to town on something you shouldn't be, because we can tell the difference. So it's wild, but food really I mean, food has a big impact on your brain function and, like, all this stuff, and I mean, it's so yeah.
Especially with the
Absolutely.
genetic methylation test and the COMT, you know, which I did order for him, by the way. I'm not sure he'll take it, but I guarantee you he's gonna either have an MTHFR or COMT. Something's gonna be messed up with him because it definitely, when he eats, his brain is overstimulated for sure. He'll actually
Mhm.
stutter, and he doesn't decompress well. Like, he just gets really stressed. Like, not normal. It's abnormal, if that makes sense.
Yeah,
Mhm. Mhm.
yeah.
Yeah, I mean, there's a lot of, hypotheses of how foods affect us. I mean, the one that's coming to mind with him, but I don't know, you guys will see as you go down the path with him. But of course, gluten and dairy can bind opioid receptors. So there's like the glutamorphines and the casomorphines. I'm not a big expert on this, but that is one hypothesis of how gluten and dairy can affect people. But like you said, methylation is a big deal. And B vitamins are huge for depression and anxiety, right? I mean, there's lots of great studies on folate for depression. I mean, high dose folate is used as a treatment for depression, even in the pharmaceutical world. So, those are some biggies. I have a few other ideas, but I figured I'd open it up in case you guys had
That's
anything
the cool
else.
thing about the testing is the testing, you always find the answer. Right? If you really can get those 3, genetic methylation, adrenal test, gut test, and organic acid test. If you do those 4 tests, you're gonna find something on every single person that has
Yep.
issues.
Yep.
So, but you kinda have to do all of them because it might not be adrenal, it might not be gut, it could be, genetic methylation, or the methylation might be fine, but they have a huge gut issue.
Hmm.
So you really kinda have to dig on all 4 of those tests, but if you have 4 of those tests, I mean, you change people's lives.
That's a really good screen. And do you find that your patients are open to that, or are they reluctant about the price, or what are you seeing in terms of helping them understand the value
I
when
mean,
you're
I just
starting out?
explained that eventually you're gonna have to do all 4 of these tests. I said, but, if you wanna start somewhere, you would start with methylation, adrenal, and gut, right?
Mhm.
We could start there because if your adrenals are messed up, I can't really fix your gut anyways.
Mhm.
So, but I always offer
Mhm.
4 up front. If they wanna do 4 up front, then the bare minimum would be a genetic methylation and an adrenal test, and let's just see what we
Okay.
find. But if the adrenals are messed up, then I know you're very likely to have gut issues because your immune
Mm.
is gonna be down.
Mhm.
That gives me a couple months at least to start fixing their adrenals because adrenals take time.
Right.
I'll typically do adrenals for 2 months anyways before we address the gut. So during that 2 months, they can get their gut test done, and when that comes back in, and if the adrenals are messed up, that's messed up 100% of the time,
Mhm.
and we can address the gut. So that's kind of the way we do things.
That's great. And then if they aren't game for doing a couple of tests in the beginning and they just want to do the adrenal test, the benefit there is you can probably get them some noticeable improvements with that one area.
Yeah, genetic methylation and adrenal test. If there's issues with either of those and you fix it, they'll feel it, right? And then they trust you.
And then they are buying in better into the
100%.
process. Yeah.
100%.
Yeah, that's great. Now, other things that I like to look at when there's depression or anxiety or ADHD or other, mood complaints are amino acids. That is an awesome area. I've seen in depression tanked amino acids. I really like plasma amino acids. So they can have really low amino acids, and those literally are the building blocks for the whole nervous system. So, I mean, we get to see the neurotransmitters when we look at organic acids, which is very important for this.
Right.
But sometimes it's nice to see a little more, to see the whole pathway for methylation, to see the whole, the precursors to some of these neurotransmitters. And even something like glycine is a neurotransmitter, glutamic acid. So, for those of you who are practitioners out there, that's something to keep in mind. And then, of course, fatty acids. I mean, there's great research telling us that EPA and DHA are critical for brain health because the brain is really rich in fat.
Yep.
Mhm.
So those are, and I mean, I think I'm preaching to the choir if we talk about exercise, right? I'm sure your patients that have mood issues, exercise, if they're not exercising regularly, that's probably a big thing that you guys talk about.
I think a lot of times it's a challenge for them though, because if they have, these, their cortisol high, they don't sleep well, so they're tired all the time, right?
Mhm.
So then to ask them to exercise, they don't have the energy to exercise. So that's why it kind of goes back to, at least, in our clinic, we really kind of focus on adrenals first,
Mm-hmm.
just to give them the energy to move forward with other stuff. Because if their cortisol high and they're not sleeping at nighttime, or they're waking up from sleep, or they're not getting a good rest of sleep, you got to get that thing balanced out.
Right. Yeah. I mean, it makes a lot of sense. It's very foundational, just the circadian rhythm and coping with stress. I mean, life is full of stress. So, making it through the day without losing it feels a lot better.
Yeah, I tell people all the time, like, listen, stress is like the silent killer, and it will sneak up on you one way or another. And when it does, it's when you have to work really hard to get back to where you want to be, it's like going to take you longer. And
Hmm.
people, I think, like, I was just talking to people on TikTok, and I was telling them, like, how did I get here, and it's because I was in a very stressful career, and then, like, I went through another episode where, like, my hair fell out, I ended up with Hashimoto's, and, I couldn't sleep at night, I was having night sweats, I mean, I was all jacked up, and, that's when we did the testing, right? And that's how
Hmm.
we knew that my cortisol levels were just, like, terrible, my gut was terrible, I had all these gut infections. I'm really into fitness, so the organic acids was really big for me, I thought that was
Hmm.
so cool to look at, and, once we started putting me on a program to take different supplements to help me bounce back, I mean, I didn't wanna work out, I had no desire to go to the gym. I couldn't sleep, I was fatigued all the time, and I tell people, stress will definitely sneak up on you like click clack, and when that happens, you're gonna be like, "What just happened?" And then you're gonna wish that you had one when you tell people, "Hey, listen, you need to calm down. You need to take stress out of your life or try to get better coping skills with stress." People are like, "What are you talking about?" Because you know what I mean? They're like, "What are you even saying to me?"
Right.
And, it
How do
was
I do
funny.
that?
Yeah, like, Tiffany at the office was like, "Okay, well, we're gonna have you not be so stressed." And I'm like, "What?" And what's crazy is, like, in your younger days, I thrived on
Yeah.
stress.
Yeah.
I
And there
loved
are
it.
people that thrive on stress.
Yeah, I
Absolutely.
was
That
like,
adrenaline junkie feel.
"Yes," and I was like, "Give it all to me." Like, that's how I really, I think, strived in my last career is I
Mm-hmm.
really worked off stress, and
Mm-hmm.
now to where I am today, I'm like, "Oh my god, that was so stupid of me." And it's easier said than done to tell people, "Don't stress out," or "Figure out a different way," or "Do this or that," but I'm telling you, it will catch up to you one way or another, and I'm telling you, when it does, it's like, "Oh my gosh," and then, it takes you about a year, right? These tests, I mean, you take the test and a program can be 6 months to a year to get you back to maybe where you wanna be or even better, and I think it's probably even better because 'cause I'm even better now where I am than I was, right?
Mm-hmm.
So that's
Right.
something else for people. It's not like a long-term life thing after you take the test and you start these supplement programs. It's literally some of them can take 6 months to a year depending on how bad it is, but
Mm-hmm.
once you do that, it's like a game changer. It's like, "Oh my god, now I have 20 years of my life back." That's how I
Right.
feel anyways.
Right. And you have tools, because I mean, things will come up in life where, you'll have health challenges or multiple things will hit you at once, but now you have tools. You end up learning where your weaknesses are, like, okay, this is an area where I always have trouble. I better, if life's getting hard, I better shore up on my B vitamins, or I better make sure I'm getting sleep, or I better, get the sugar out of my diet even though it's the holidays, I can't do it, cuz the stress is high. So you kind of learn these tools for managing later in life too.
Mhm.
One other thing I was going to bring up was mitochondria. It doesn't come to the front of my mind always, but just through the years of studying this and teaching about glutathione, it's good for us to all remember that the brain is chock full of mitochondria, and that those are the little powerhouses of our cells. And so when there's problems in the brain, the first thing we want to do is support the mitochondria. In fact, so many neurodegenerative diseases, right? Not necessarily depression or anxiety, although I'm sure oxidative stress is part of them, but it's very well established that neurodegenerative conditions like Alzheimer's, like Parkinson's, ALS, these are driven by oxidative stress in the brain, which is basically mitochondria that are unhealthy, that are over making a lot of energy and creating a lot of oxidative damage. They're not being kind of counterbalanced the way they need to be. So those are definitely some things to think about for root causes with psychoemotional disorders.
Yeah, I can tell you, we've had some interesting experiences. We use a lot of NAD in our office
Mm.
via iontophoresis as a delivery mechanism. And I can
Mm.
tell you, we've had people that have Parkinson's tremors, and you put them on NAD, and the tremors noticeably decrease.
Mm.
People that have been
Wow.
diagnosed with Alzheimer's, like noticeable improvements in cognitive ability and ability to recall. So, but that all goes back to, the NAD stimulate, basically giving the mitochondria more energy, 'cause it's the coenzyme that makes the mitochondria work. And we've had some very profound results with that. And the other kind of cool thing is if you do organic acid testing, you'll see all these mitochondrial issues. And just using now NAD alone makes such a big difference on that organic acid. So
Neat.
that's another kind of a cool tool we've kind of figured out over time that we've had really good results in a short period of time.
What kinds of dosages are you using?
So well, that's the unique thing about using iontophoresis. The NAD is not orally bioavailable. Now you can take NMN, which will increase intracellular NAD if your body
Hmm.
converts it, but you're depending on the body to convert it. But you're still going to miss out on the extracellular benefits, which is cell signaling, anti-inflammatory. So you really
Mm.
want to take NAD instead of NMN, but you have to do that either via IV injection or iontophoresis.
Okay.
But the problem with that, if you're doing IV or injection, is back to it has such a profound effect on the mitochondria, and the highest concentration of mitochondria is in the brain. Number two is the heart. So if you take
Hmm.
too much of it, you get heart palpitations, headache, brain like that. You don't feel good. But
Yeah.
using iontophoresis, you can dose 1,300 milligrams, which is a huge dose,
Mm.
but it spreads it over 12 hours, so you don't get any of those side effects.
Mm.
And the other cool thing is, NAD half-life is only about an hour. So even if you're doing an IV or an injection, it's in and out of your system so quickly. Where if using iontophoresis, you're going to dose the tissues and dose the cells for 12 hours, getting a much better
Mm.
effect.
Mhm.
Wow. Interesting. Yeah, that's a pretty good dose there. I see. Awesome. I hadn't heard of that before. That's really interesting.
And the other cool thing we do with that is if you microneedle ahead of time,
Mm.
basically what happens is, the way iontophoresis works, it uses electric energy to push molecules directly through the dermis and into the bloodstream.
Mm.
But the stratum, which is the dead layer of skin on the outsides, is the most difficult layer for it to push through. So we simply have our people use a microneedle device, microneedle over top of that area to create microchannels, and
Mm.
then put the patch on. I
Mm.
have to have a patch on today. I don't-
Oh yeah.
Oh, look, you can show us. Oh, wow.
Yeah,
Cool.
he has his on his arm and I
Uh-huh.
wear mine on my stomach area.
Oh, look at that. Neato,
Yeah.
guys.
Yeah.
Okay.
Yeah.
Interesting.
So mine is a little different. Mine's with KPV and NAD
Huh.
because I have Hashimoto's. So
Mm-hmm.
I do KPV with it. And then what's yours?
Straight up in NAD.
Okay.
I'm rocking today.
All right, got it.
What was
And
on
when you take
yours?
NAD, you have tons of energy. So
Yeah.
That's really neat, guys. Cool.
Yeah. It's really great. I love it. I think I really like mine when I travel using NAD straight up because
Mm.
I get like motion sickness from the flights and stuff,
and
Yeah.
jet lag,
jet
it's
lag,
amazing.
and so it's amazing for that. I mean,
Huh.
I like it a lot, and so
That's
anyway,
neat.
it's
That's neat.
cool. Yeah.
Yeah, so I do have a case study I can tell you guys about if you
Awesome.
want, or we
Yes.
can. Yeah, you want to jump into that?
Yeah,
Yeah.
let's do
Would
it.
love to.
How much time do we have just so I don't run over or take too long?
We have about 15 minutes.
Okay, that should work. That should
Yeah.
work great. Okay, great. Yeah, let me tell you guys about this case. So this is not my case because I'm not in clinical practice. Although I've been doing this about 18 years, I've been, doing integrative and functional medicine consulting, and I wrote a book, Heal Your Oral Microbiome, and I consult for laboratories. And I just, basically I'm just a big advocate and researcher of integrative and functional medicine. But this is a case. So I often will collect case studies. In fact, I should bug you guys after the show if you guys have any case studies. I do like to talk with practitioners about gathering these cases that can be like teaching tools for other people. So that's kind of what this was. So this in this case we had a 15-year-old. A 15-year-old female. She was, and we can call her. Dee Dee. Let's call her Dee Dee just to make it easier to talk about her. So she was complaining of anxiety. She had intrusive thoughts. She was withdrawn and she didn't speak much. She had these neuropsychiatric symptoms would flare up until she would take binders. And then if she would discontinue her binders, and for those of you who are listening, binders are things like activated charcoal or other clay that people take in the gut to kind of bind things and clear out toxins and pathogens. When she would go off of these binders, her neuropsychiatric symptoms would come right back. So the
Wow.
parents were very worried about their 15-year-old, of course, Dee Dee, and they were considering antipsychotic medications because that was really the option that they were given. But because these parents were kind of natural medicine minded, they were looking for the root causes, like what we talked about today. You know, they were seeking out help from a naturopathic doctor to find out, okay, what could they do for their daughter to hopefully try to avoid these antipsychotics. Now, Dee Dee did not have any gut issues. She had no bloating or discomfort of the abdomen, and she had regular bowel movements. So it seemed like, there were some signs suggesting that her gut was pretty good, functioning pretty well. Now, what an interesting piece to this story is that there was mold exposure in the past. So, this family, the entire family had been working with this practitioner. It was first the father who had been affected. When they realized he was suffering from mold illness, then they treated the house, they remediated the house, they even moved homes. But later they realized that their kids were affected. So even though that they had done all these things and mold was supposedly completely dealt with, the kids were getting sick. And so the practitioner was kind of coming to the family was coming to this practitioner saying, okay, we're still sick and we need to figure out what's going on. Like we're not done with this apparently. Okay, so this 15-year-old was already taking, Dee Dee was already taking things. She was on B vitamins, she was on the binders, as I mentioned. She was taking DHA, so that's a fatty acid that's really good for the brain, vitamin D, phosphatidylcholine, and L-theanine. So, they were taking some natural, some dietary supplements to try to give her some relief. And like I said, the binders were one of the most powerful treatments for her. Let's see. So I'm going to talk to you guys a little bit about what her test results show because we ran an organic acids profile with Diagnostic Solutions. And just to remind the audience, so this test covers 5 different categories of areas. It looks at energy and mitochondria. It looks at nutrition, stress and mood, toxins and kidney markers, and the gut metabolome. So it even has like a little view of looking at the gut. It's not as comprehensive as a stool test like a GI map, but it's still a nice little view of the gut. So interestingly, Dee Dee had extreme mitochondrial dysfunction, right? We were talking earlier about the mitochondria in the brain. So Dee Dee had really abnormal mitochondrial dysfunction. And now, I mean, I could stop here and ask you guys before I give away all of the results. What do y'all think? What do you guys think about this case? Like, what would your thoughts be, knowing that she's got psychotic thoughts, intrusive thoughts, and she's had this mold exposure, and binders make her feel better, etc. Give
Well,
y'all a chance to say what
she's
you
gonna have a
might
gut
think.
issue for sure, right? Because the
Which
binders,
one?
have some type of gut issue for sure,
Hmm.
because she's Herxheimer reaction of some type, and the charcoal is catching it. But you need further gut testing. So you asked me earlier, is there one test you can do? Organic acid test kind of does everything,
Right.
but then you got to
Right.
go back to do. I mean, but then you end up have to do the test anyway. So, but that's kind of why like I do it on the backside, because if I didn't fix the gut all the way, it'll show up on that test, or you'll find other stuff.
That's a
Mm-hmm.
good point. It's kind of a second look at the gut.
Yeah,
Yeah.
and I really have all our patients once a year just redo organic acid because you change over time, right?
Right.
That's
Yeah, it's
a good overview for sure.
absolutely. Yeah, and I used to work with Andy Brawley at Metametrics Clinical Laboratory. He used to say it was the serum chemistry of functional medicine because you can just kind of grab a bunch of information. It's an easy urine test. Once a year is a great time to just check on how things are doing, just
100%.
like you would with a serum chemistry, but the serum chemistry doesn't get it all, of course. Okay,
Mhm.
great. Yeah, absolutely gut. I agree with you. I would have been thinking gut too. Now, in a patient like this, I'm thinking neurotransmitters, wondering how her neurotransmitters are doing, of course, because she's kind of textbook case, like, okay, well, how are these neurotransmitters? Um, and what was very interesting about her is that her neurotransmitters were completely normal. So
Yeah.
norepinephrine, epinephrine, dopamine, and serotonin, which are all shown on the test, everything looked normal, which is, she didn't really fit the mold, so to speak. Now, another thing that showed,
Amino acids and oxidative stress markers.
well, on the organic acids profile, we don't have amino acids. Let's see, did she have oxidative stress? Let me just check. I don't remember oxidative stress being a big problem. Let me just see if I don't think she showed a lot of oxidative stress actually. But what she showed was glutathione need.
Okay,
So
yeah,
Mm.
so
even though, yeah, even though she didn't show a lot of oxidative damage, it was like her pyroglutamic acid was super high, and her alpha hydroxybutyric acid, which tells you about how much glutathione she's able to synthesize, is low. And of course, glutathione is the master antioxidant. It's critical for brain health, and so her glutathione was depleted. Also, and as I mentioned, her neurotransmitters were normal, which kind of, was surprising. Now, Dee Dee showed massive B vitamin needs. She had really dramatic, like 6 times the reference range, um, 2.5 times the reference range. Multiple of her B vitamins were lighting up. She needed B12, she needed folate. And what is so interesting about this is Dee Dee was taking B vitamins. So I always like to point this out that even when
you
people are
taking
taking
were they methylated?
supplements,
Were they
say,
methylated B? Was she taking methylated B vitamin?
yes, they were. It was a good, because she'd been, this naturopath had been treating her and then was kind of testing her to see what they were missing.
Mhm.
But yeah, this can happen. It can be that her needs for B vitamins were much higher than what she was getting. You raise a good point about the form. What form of B vitamins. Um, we have a question about the gut. The gut can if there's gut dysbiosis, that can interfere with B vitamin synthesis. So that was pretty interesting. And then lastly, she did show gut dysbiosis on the organic acids profile. So we saw that there is some gut dysbiosis there. Um, Now, this practitioner, let's see,
So that's why she wasn't absorbing the vitamins.
it could be, yes, that definitely so. Now, something else that we didn't, I don't normally go into too much with this case. She did have low normal cortisol. So going back to your point about the adrenals and stress response, and she did show some markers of toxic exposure because she had high glucaric acid. That's a marker of glucuronidation. So, um, she had a lot going on. I think we could say that, and that's no surprise, right? When a 15-year-old is this sick, chances are they have a lot going on, and it's going to be a few layers to the onion, as we said earlier. Now, we also got a GI map on her. This practitioner ran a GI map as well, kind of like you guys. She's running GI map and organic acids profile. And Dee Dee had a widespread dysbiosis on the stool test. Both all her good bugs were overgrown. Her opportunistic bacteria were overgrown. She had a non-pathogenic parasite. She was having problems digesting, and she had poor immune function. Her SIG-A, or immunoglobulin A in the gut lining was very weak. So um, she was really struggling. It was no surprise, right? So the clinician decided they felt like the gut dysbiosis and the mycotoxins were the top priority, and
Mhm.
then glutathione need and B vitamins. So that was what they did. And I don't know, would you guys like to talk a little bit about the protocol? Is that appropriate for this audience, for your
Yeah.
Yeah, yeah,
podcast?
sure.
Yeah. Of
I
course.
feel like whether it's consumers or practitioners, it's sometimes nice to hear what people are doing for treatment. So this practitioner continued with binders, right? Binders were already helping Dee Dee, so they kind of went heavier on binders. Now you wouldn't do this for long term, right? Because binders are going to interfere with absorbing other things too.
Sure.
But this young lady was doing so well with them, she went ahead and did that. The practitioner also, and this is only to do with an experienced clinician, she gave high dose single B vitamins. So the patient was already on a B complex, but then she really went high with some others. Like for example, I mean, some of these dosages are uncommon that I hear from anybody in our field using. So it's pretty aggressive. She was using 1,000 milligrams a day of thiamine. She gave her 2,500 milligrams a day of pantothenic acid or B5, and
Mhm.
she gave her 200 milligrams a day of P5P. That's the active form
Wow.
of B6.
Wow.
And she has experience. You know, this isn't something you do without having practice
You
it.
have
These are
you have to
pretty.
have testing for sure too.
Yeah.
Yeah, and she separated them because she felt like that might be more effective. Like the fact that this patient was already taking B complex and it was showing that she still needed a lot of B vitamins, she was kind of trying to overshoot the mark now. And the other thing this clinician mentioned is that, you know, some of these B vitamins are really effective in psychiatric illnesses.
Mhm.
So
Mhm.
there's kind of that background. I mean, I think it's B6 can treat seizures, and of course, folate at really high doses, as we mentioned, can treat depression. But I think there's more on B6 in terms of psychiatric disorders. Now, the practitioner also gave glutathione. Now, Dee Dee couldn't tolerate a lot of glutathione. She could only take 300 milligrams twice a day. She was very sensitive to glutathione. The clinician gave her minerals and gave her cromolyn, which is a treatment actually for allergic reactions that kind of helps break down allergens. But again, this was kind of from the clinician's experience that this helps with neurological symptoms sometimes when the gut is involved.
Yeah, a lot of times too, you'll find that's where we use the iontophoresis to administer glutathione too, because a lot of people don't tolerate it. Well, oral absorption's not that great anyways. It's around 10%. So you can really bypass that if you and once again, I think glutathione half-life is 10 or 15 minutes.
Mm.
Where if you use an iontophoresis patch on someone, you can give them 500 milligrams, but dose it over 12 hours and you get a really good cellular effect.
Mm.
Wow, that's really interesting. I'm glad to know about that because there are clinicians that are really working to try to get glutathione in. Yeah,
It's just hard because oral absorption's poor and you can IV it, but once again, that 10 to 15-minute half-life, you're gonna get that huge spike and then nothing. So,
right.
anything when you're dealing with cells or tissues, the longer the exposure, the better.
Mm.
Okay, neat. That's really neat. It seems doable to wear a patch is pretty convenient. It's not too much too
Yeah.
inconvenient there. Okay, so phase two of the protocol was to treat the dysbiosis. So they did antimicrobial herbs, they did mastic gum, there was some H. pylori in the mix that they treated. They did some butyrate, which,
Mhm.
you know,
Mm.
helps nourish the gut lining and the microbiome, and also slippery elm. These were at standard doses. Okay, so here's our follow up for Dee Dee. So within 1 month of treatment, Dee Dee reported that her intrusive thoughts had completely stopped. And
Wow.
then at 5 months treatment, she had no intrusive thoughts. She had fewer mood changes and she was more open and less withdrawn. Everything was easier to do, she said, and she was just feeling everything was feeling better and easier. So the
That's amazing.
clinician
Yeah, I
really
love
the
that.
yeah, yeah. No, I mean, this was a big deal, right? To be able to get these changes that really lasted almost 6 months.
I think
Now,
it's
the
important
clinician,
too
go
sorry,
ahead.
I hate to jump you there.
No, you're
A
fine.
lot of times people will say, "Well, why would you test my gut? 'Cause I don't have any gut issues."
Mhm.
Right,
Realize that 80% of people that have gut issues don't have any direct gut, like, indigestion, heartburn, normal stools. Like, so just because you don't have gut, what we consider typical gut issues doesn't mean you don't have gut problems. I would say
right.
the majority of the time. So,
Yeah, I think that's a great point. You know, because if you were just going on off clinical symptoms alone, you might think, oh, this patient's gut's probably okay, you know, except for that binder thing where she did better on
binder
binders.
thing is a clue there. Yeah, the binder's
That was a big red flag. But otherwise, she's pooping regularly. You know, why worry about the gut? So the clinician did want for her next steps were to discontinue the binders, right? That was going to be the ultimate test
Mhm.
with this patient. That was her plan, and then monitor for psychiatric symptoms. And that I want to give just a shout out to Jesselyn Chames, this ND at Clementine Natural Health, who submitted this case and is so helpful to teach people from. But in general, just to kind of wrap up about Dee Dee's case, we got a lot of great information about Dee Dee from the organic acids profile. We saw issues with her mitochondria, with glutathione, with B vitamins, and of course gut dysbiosis, and her neurotransmitters were normal, which was
That's
surprising
inter-
to me.
that's interesting.
But it happens, right? Everyone's a snowflake, and that's why it helps to have this testing information. The treatment helped resolve her anxiety and intrusive thoughts after 1 month and lasted until 5 months out. And the patient and family were pleased with the progress and hopeful that they could continue to avoid antipsychotic medications. So this is
Mm.
an interesting case with Dee Dee, and I need to get some follow up with the clinician to hear how it went when she discontinued binders, but I don't have that yet.
Yeah, that would be
And
great.
luckily, the parents thought outside the box because
Yeah,
most parents wouldn't do that, and they'd probably just go see a psychiatrist or a counselor, and that kid would end up on medications, and that's a whole rabbit hole, you know?
mhm.
Right, right. Like Daniela said, you go to the doctor and you do what you're told. You do what they say. It takes a lot to be like, oh, well, this isn't what I want to do. Let me try something else. Let me go do research. Let me reach out to get consultations about this. It's more work.
Yeah,
Yeah,
I mean, the problem with the medical system is the average doctor visit is, I think, 6 minutes in the United States. You can't diagnose a complex problem like this in 6 minutes. So, you're there, you have 6 minutes of FaceTime if you're lucky, and they're gonna give you a pill or a potion to treat the symptom, but that doesn't do anything with the root cause.
right.
Exactly.
Wow.
And the environmental part it's such a kind of a Pandora's box, right? Like she had been in this, mold sick house, and mainstream clinicians just aren't trained in that. There's not much about that they even can help anyone with. So that's more of an area of an integrative and functional medicine and environmental medicine. Yeah.
And I don't think people understand how serious, like, mold exposure is. Like, I mean, I have somebody that works for us, and, she's just been, like, she's been complaining a lot. She was on a GLP-1, she can't lose weight. She's, like, having brain fog, massive brain fog, memory issues, whatever, and I start talking to her, and I'm like, "Girl, like, there's something going on here." So she did the testing, and, man, her gut was not terrible because we did the GI map before on her, but when it came back again, it was really high with, like, fungus and yeast overgrowth, like, through the
Mm.
roof.
Like, we cured the
Hmm.
H. pylori. She had a bunch of
Yeah.
H. pylori and other
Okay. Yeah. Now that'll cause brain fog for sure.
we killed all that, but it came back. So we tested her again just for the heck of it, and it came back, like she said, with all this yeast and stuff.
And so I started talking to her, and I was like, "Is there any possibility of mold in your house?" And she's like, "Yeah," because she, had to move back home with her parents, and she said that her house is super old, and in their bathroom, there's mold everywhere. And I'm like,
Oh
"Oh my
gosh.
gosh." And I told her, like, "You know how dangerous this is?"
So there's mushrooms growing out of the wall.
Yeah, there's mushrooms growing out of the
That's
wall.
what she said?
Yes. And I was like, "This is so bad," and her dad's sick, her mom's sick,
Oh boy.
and, I told her,
Oh
like,
boy.
"This has gotta stop." So she's like, "Can I put you on speakerphone?" I was like, "Yeah." And I told her dad, I said, "Sir, mold exposure is so toxic, it's so dangerous." And I said, "This is why all of you are sick." I'm like, "This is why, you know, my girl, like, I don't even think she'll care, but this is why she literally can't think straight. Like,
Yeah.
she has massive brain fog. She can't even think. When I tell her
Right.
something, she has to write it down, and then she's, like, scrambling through notes, right?
Yeah.
And I'm like, "So you have got to get the mushrooms out of the ceiling." You know? And
No.
she's,
Yeah.
like, telling me she's in there, like, cutting them down and, like, washing them off, and I'm like, "No, you have to hire professionals to
Yes.
handle this." It's
Yeah.
so bad. So, I mean, this is just for any listeners out there, like, mold exposure is so bad. It is something to take very serious and not lightly, mold is not good for you. Like, it will mess you up.
And you really got to be careful. If you see it on the outside of something, you know what's going to be behind the walls. So
Yeah.
you can't just
Right.
spray some Clorox on it and think it's going to be
That's
fixed
what she
because
said. She said she took a bleach and was wiping it off the walls. And I'm like, "No." I'm like, "It's behind the walls. Like, it's now everywhere, I'm sure." And no
Yeah, and it
wonder
contaminates the whole house.
yeah, it's so bad. Oh, mold exposure is so bad.
Yeah, it's
So,
serious. And then there's people who
anyways, if
don't
you're
have
listening,
symptoms.
yeah,
Yeah, and there's people who don't have
right.
symptoms from mold, but it's still wearing away at their health. So, some
Mhm.
people are kind of resistant to some of the symptoms, and other people are very sick. And it can be any variety. I mean, I've even heard of mold in the house causing reflux, and of course, like brain fog is more classic, or upper respiratory illnesses, but fatigue, musculoskeletal joint problems and pain and arthritic conditions. I mean, it can manifest in a lot of different ways that you don't expect. That's the other tricky thing about it.
Well, yeah, and you said something good. Just because, like, you don't have symptoms of something, I had somebody make a comment, to me one time where they were like, I'm, like, in perfect health, I'm so perfect, I'm never stressed, I'm never this, I'm never that, I have none of this. And, just because you don't have symptoms of something doesn't mean there's not anything happening. Like, there could be something brewing up on the inside you just are unaware about because you might not be having a symptom to that right now, right? But
Exactly.
but you will eventually end up there will be a symptom of something down the road. So,
well, a lot of times that symptom. I had a patient that he wanted to come to us. We do stem cells and other things at the clinic. But he's telling me his history. He's had two back surgeries, and he has every day does a 40-minute program for his back, and he eats really healthy. But he still keeps having once a year have an episode where his back goes out.
Mm-hmm.
I'm like, I mean, that just doesn't make sense. And he's a healthy guy. Like, if you saw him, he looks really physically fit. I said, something doesn't make sense here. Like, we gotta either gonna have adrenal problems or gut problems or both. Let's just do these tests, and I promise you, we'll find something.
Mm-hmm.
Sure enough, it came back. Cortisol level was literally off the charts all day long. So he's
Hmm.
catabolic all day. So no matter what we did or anyone other provider did, he's not going to heal, right?
It was really high
Yeah,
all
super
day.
high. It was off the chart high, like out of range high all day long.
Wow.
And his gut had multiple infections. So he has leaky gut, which is leading to systemic inflammation. And that's why this person here, even though he's 40 minutes a day exercising, eating healthy,
Mm-hmm.
working out, he continues to have these back flares. So I was like, if you don't fix the root cause here, whether we do stem cells, PRP, whatever therapy we do, nothing's going to last because you're catabolic in nature.
Right.
mhm,
So, and if you don't fix that, you're doomed. And the bigger problem there is if your joints are catabolic, that means your arteries are catabolic, the blood vessels, heart, like your brain tissue, is breaking down.
mm,
So,
Yeah, I mean, we all call that cortisol stress hormone, we call it the wear and tear hormone because it's a wear and tear. I mean, we are not meant to be in fight or flight all the time. Our bodies can't tolerate that, that it will cause breakdown of every system because, your cortisol is trying to save you from the lion that's chasing you. It's not worrying about if you're going to be okay in 5 years, or if you're going to still be in one piece. It's like, just get away from the lion. So it's a
I tell
very
people that.
dangerous thing to have very high like that all the time.
It is. Wow, what a good I'm so glad you could be here today and go over this with us, and so glad to see you again. This was
Me
a
too.
great
Thank you
episode.
guys. Thank you so much. It's a
W
pleasure working with you guys. Y'all are so fun and your podcasts are so interesting.
Yeah. I think, it's exciting, and we love putting this out there for people because we really want people to start understanding that, these things are not normal. I think, we live in a like you said, every day is stressful for people. We live in the United States of America where it's like go time 24/7.
Hmm.
And a lot of people chop up these symptoms as to being normal, and I always tell people, like, it's not normal to always be tired. It's not normal not to sleep. It's not normal to be chronically fatigued and exhausted and bloated all the time and have brain fog all the time. Like, these things are not normal, but
Hmm.
so many people are normalizing it because, like, they think it's normal, but it's not, right?
Hmm. Hmm. That's
So, I'm so glad that we went over this today and, very exciting. I can't wait for this episode to air. Would you like to share anything else?
I think that's everything. I mean, I'm also excited that I feel like we gave a comprehensive treatment. We talked about a lot of different things that could be at the root cause of, chronic neuropsychiatric symptoms that, that are unknown. The causes are unknown. So I think hopefully this gives some of your audience some help to get to the root causes and get some relief.
Yeah, I
Yep.
agree. Because a lot of people are gonna be, like, listening or they're gonna think like, "Oh my gosh, it could be that. It could be this. It could be that." But once again, we're not saying to you, "Go out there and take a bunch of vitamins." No, no, no. We're saying you need to find a functional medicine doctor, someone that does functional medicine to do the testing, because the
Hmm.
testing is what we need in
Hmm.
order to give you proper care,
Yeah.
right? So, yeah.
Customize a protocol specific
Yeah.
to your needs. Yeah.
Right. Exactly.
And definitely don't want to. The other thing we see often in the clinic is we'll say, "Well, I went to a functional medicine doctor before," and first time I said, "Well, what kind of testing did you do?" And they'll say, "Well, they just did a detox on me." Doing a detox isn't functional medicine.
Hmm.
And from my experience, if you do a detox on people that are sick, a lot of times you can make them worse. They can't handle that detox. So,
Hmm.
you really have to do, the cornerstone test, methylation test, adrenal test, organic acid test, and gut test to really figure out what's going on.
Yeah, I think that's a great, initial screen. That makes a lot of sense. And I can imagine that, you find things that will really help people feel better with those tests.
Yep.
And real quick, one more time, what was your book called that you wrote?
Sure, my book is Heal Your Oral Microbiome.
Wow,
So
okay, that's cool. We're gonna check
yeah,
that out. Yeah.
yeah,
I
please do.
wanna
It really puts forth that, if all health begins, if health is or disease begins in the gut begins with the mouth. So there's that connection. And I really do, in my writings and teachings and presentations, I do try to talk a lot about considering the oral microbiome as well as connected to the gut microbiome and treating it as one. So
Yeah.
yeah, that's my interest.
Okay, cool. Yeah, we're gonna check that
We
out
should have
then.
we should have you back on and talk about that. That's
Yeah, we
definitely interesting.
should. I love that.
Sure, I'd love
Yeah.
to.
Okay,
Hmm.
cool. I'll have
Sounds good.
Casey then get with you because I love that, and we'll make sure we read your book beforehand,
Yep.
so that way
Okay,
we can ask
awesome.
you
That sounds
questions.
great.
Okay,
Yeah.
cool. All right. So if you're listening to this episode on our podcast and you have any questions whatsoever about what we went over, you're like, hey, that's me, or I have this question. How do you address this? Comment, shoot us a message. We'd be more than happy to take care of you. But until then, we'll be seeing you around and tune in next time. All
Thanks.
right. Cool.